Having explored both rational choice models and biological factors, we now look inward to examine the psychological mechanisms that might lead people down a criminal path. Psychological theories center on how an individual's personality, thought patterns, and mental health can contribute to offending behavior. Key areas of focus: personality traits and criminality. Psychopathy, a personality disorder characterized by lack of empathy, impulsivity, manipulative tendency, and a disregard for social norms. Antisocial personality disorder, a broader term encompassing similar traits linked to a higher risk for rule-breaking and criminal behavior. Cognitive theories. Moral development examines how individuals develop moral reasoning. Lower levels of moral development may be associated with increased likelihood to offend. Criminal thinking patterns argues that offenders have distorted thinking that justifies their actions, minimizing guilt or blaming victims. Psychodynamic theories. These emphasize the influence of unconscious drives and early childhood experiences on behavior. Unresolved conflicts, suppressed traumas, or weak ego developed might contribute to criminality. Mental illness. While not all mentally people commit crimes, some disorders like schizophrenia or substance abuse disorders can increase the risk of criminal behavior. Examples of psychological approaches. Social learning theory proposes that criminal behavior is learned through observing and intimating others and being rewarded or punished for those actions. Aggression models explore how exposure to violence, frustration, or social cues can trigger aggressive behavior, leading to potential criminal acts. Behavioral therapy focuses on changing observable actions through techniques like reinforcement and punishment, sometimes used within correctional settings with offenders. Applications to justice system. Risk assessment. Psychological evaluations help identify offenders with a higher risk of reoffending, informing sentencing and rehabilitation efforts. Treatment programs. Therapies like cognitive behavioral therapy (CBT) address criminal thinking patterns, while anger management programs aim to improve emotional regulation and reduce violence. Understanding specific crime. Psychological theories can illuminate motivations behind certain offenses, such as the role of narcissism in fraud or the link between trauma and domestic abuse. Critiques of psychological theories. Challenges isolating causation. It's difficult to determine whether psychological factors are the sole cause of criminality or if they interact with social conditions or biological predispositions. Limited generalizability. Not all offenders exhibit the same psychological profile, and some psychological traits common among offenders are also prevalent in non-criminal populations. Potential for stigma. Linking crimes to mental illness can be harmful, leading to stereotyping and discrimination against those with mental health conditions. Conclusion. Psychological theories provide vital insights into the complex motivations and thought processes underlying criminal behavior. They offer valuable tools for risk assessment, developing effective treatment programs, and understanding the psychological behind specific types of crime. Yet, it's crucial to remember that psychological explanations are just one piece in the puzzle of understanding crime and its causes.